highest risk situations are intense conditioning sessions rather than competitions. Conditions that might increase your risk for complications during intense exercise include a significant and sudden increase in exercise intensity, a lack of acclimatization before starting intense exercise bouts, experiencing distress while at altitude, in the heat, or poorly hydrated, exercising with acute illness such as with the fever, drug, alcohol, or stimulant use.
So if an athlete is sickle cell trait positive, they can take certain precautions. Those include primarily staying hydrated. So in studies that they've done with sickle cell trait athletes, they've shown that when somebody remains hydrated, their blood cells don't sickle. So somebody who remains hydrated, drinks a lot of fluid, they're going to be at the exact same risk as somebody who doesn't have sickle cell trait. The other thing that athletes need to think about is when they're exercising in the heat. Exercise in the heat puts an extra strain on the body, and so that's when the athlete with sickle cell trait needs to think about, again, staying extra hydrated, really listening to their body, and getting out of the heat, being well conditioned. So you shouldn't go from being not conditioned at all to exercising at full bore, so gradually condition and work your way up. These are all things that the athlete with sickle cell trait needs to think about.
Although all student athletes must receive education regarding sickle cell trait status, you may waive the requirement that your college or university confirm your sickle cell trait status and decline any test administered for that purpose. However, student athletes who waive confirmation must be provided additional education regarding sickle cell trait. Additionally, if you decline the test to determine your sickle cell status, you will be asked to sign a waiver by your college or university. By signing a waiver, you will agree to voluntarily give up any legal rights you may have, including the right to sue your college or university and the NCAA as a result of injuries you may suffer as a result of sickle cell trait. You should only sign the waiver once you fully understand the risks of sickle cell trait and are willing to surrender your legal rights in the event you suffer an injury caused by sickle cell trait.
To reduce the risk of a collapse, all exercising individuals, including those with known sickle cell trait, should be counseled to hydrate sufficiently, acclimatize gradually to heat, humidity, and altitude, condition carefully and gradually for up to several weeks before engaging in exhaustive exercise regimens, do not exercise at a level significantly higher than current conditioning level, refrain from extreme exercise during or while recovering from an illness, especially one involving fever. Report your illnesses, injuries, and the use of medications and nutritional supplements. Refrain from consuming high caffeine energy drinks and other stimulants, especially during exercise, as they can mask fatigue and make you exceed workout thresholds. Immediately stop exercise and seek prompt medical care when experiencing unusual physical distress. Knowledge of sickle cell trait status can be a gateway to taking simple precautions that may prevent exercise collapse and allow for optimal performance. Do you know your sickle cell trait status?